is this the home of Matthew Byrne, 585 Simonside Terrace, Newcastle upon Tyne?
Yes, it is.
Hi, my name's Steph. I'm one of the asthma nurses from the asthma clinic, and I've just been sent out today to teach you and Matthew how to use his new inhaler, salbutamol. Were you expecting me?
Yes, actually, I'm expecting you.
Is it okay if I come in?
Yes, you can.
And can I just ask what your name is? Sorry.
You can call me Anne.
Great, thank you. So just before I come in, can I just check, do you have any pets or children at home?
There's none.
No, okay, great. So I can declare that the scene's safe. I'm happy to enter, and I'll close the door but not lock it for my patient's privacy and safety, but for my safety too. Okay, so Anne, is there a hand gel or sink I can use for hand hygiene?
Yes, you can use the alcohol gel and the deep one.
Thank you. So I'll do my hand hygiene, palm to palm, back of the hands, fingers interlaced, interlocked, thumbs in rotation, fingertips, and let it add for 20 to 30 seconds. Okay, so I'm happy to proceed to my patient. So hi, my name's Steph. I'm one of the asthma nurses, and I'm here today just to teach you how to use your new inhaled medication, salbutamol. So first, I just need to check that I'm with the correct patient and check it against my documentation. So could you tell me your full name and date of birth, please?
Yes, Matthew Byrne. My birthday is 3/05/2010.
Okay, I can confirm that that matches my documentation. And Matthew, do you know if you have any allergies?
I don't think so. My mom didn't say so.
No. Anne, would you mind just confirming that Matthew has no allergies?
Yes, there's no allergies.
Okay, great. I can confirm that that matches my documentation. So like I said, I'm here today to teach you how to use your salbutamol inhaler. So the first thing I'll do is just read through the prescription. If any of the information's incorrect, please just let me know. So I have my patient's name as Matthew Byrne with the address of 585 Simonside Terrace, Newcastle upon Tyne, with a postcode of NE6 5JY and a date of birth of the 3rd of May 2010. And like you confirmed for me, there's no known allergies. So I'm here to give the salbutamol inhaler via inhalation, 200 micrograms, which is due today, the 29th of November 2023 at 12 o'clock. It was prescribed by Dr. S. Ravi with his name and signature, and this was prescribed today, the 29th of November 2023. We have a weight of 30 kilograms and a height of 133 centimetres, so I can confirm that the prescription is valid, signed and legible, and I'm happy to give this today. So Matthew, and salbutamol inhaler can have some side effects. So some of those side effects are that it can cause a faster heart rate, palpitations, but don't worry, these side effects are quite rare, and after I've given you inhaler, I'll stay for the next 30 to 60 minutes to observe you for these side effects, okay?
Okay.
So if you're happy for me to proceed, I'll just go and gather the equipment and then I'll come back and teach you how to use it. Okay? Thank you. Okay, so I'll do my hand hygiene. And put on my PPE. Assessor, can you confirm if my tray is reusable or disposable?
Disposable.
Okay, so I can see that my tray is clean and intact, so I'm happy to use this. Here I have my spacer. Assessor, can you confirm, is my spacer brand new or has it been used?
It is brand new.
Okay, so because it's brand new, I'm happy to use it. It's clean, dry and intact, has no cracks. If it had been used before, I would like it to be less than 12 months old and to have been cleaned with soap and water and properly dried within the last 24 hours. And here I have the salbutamol inhaler, which matches my prescription. This is 100 micrograms per puff with an expiry date of the 11th, 2027. So I'm happy to use this. My patient's prescribed 200 micrograms, so I'll be given 2 puffs today. So now I've gathered my equipment, I'm happy to proceed back to my patient. So hi Matthew, I've got all of that equipment ready now. So would you mind just telling me your full name and date of birth again, please?
Yes, Matthew Byrne, 3/05/2010.
Okay, great. So I can confirm that that matches my documentation. So like I said, I'm here to do your salbutamol inhaler today and I'll teach you how to do it. So if at any point you don't understand my instructions, just let me know, okay? So the first thing that I'm going to do is show you that this is your spacer and this is your inhaler. So you need to remove the mouthpiece from your inhaler, and every time before you use it, you need to shake it for 2 to 5 seconds, okay? Like 1, 2, 3, 4, 5. You'll then be inserting this into the end of the spacer like this, and it'll just slide in. Before you take any of your medications, your inhaled medications, you need to be sat in an upright position. Are you able to do that yourself, or would you like some assistance? Okay, great. So I'll then remove the mouthpiece from your spacer, and I'll talk you through the instructions. So you're already sat in the upright position, so then what I'll need you to do before I give your inhaler is exhale fully through your mouth, and then tip your head back slightly and create a seal around this mouthpiece with your lips, and then inhale slowly for 2 to 3 seconds. Does that make sense?
Yes, I can try that.
Okay. So after you've done that inhale, there's 2 different techniques we can use. So the first technique is single breath technique. So for single breath technique, after you've inhaled for 2 to 3 seconds, you'll then hold your breath for 10 seconds with the spacer in your mouth. I'll then take it out and you can exhale through pursed lips. If you don't think you'll be able to hold your breath for that long, we can do the multi-breath technique, where after that initial inhale, you breathe in and out steadily 5 times. I'll then remove the spacer from your mouth and again you can exhale. Which technique do you think you'd like to use?
I think I will prefer the single breath technique, or the first technique that you mentioned.
Yeah, that's fine. So like I said before, we'll get you sat in that upright position. I'll shake the inhaler again just before we give it. So 1, 2, 3, 4, 5. Insert it in here. Okay, so if you can just exhale fully for me.
Exhale.
Tip your head back and make a seal. And inhale, 2, 3, and hold your breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And exhale through pursed lips. Okay, Matthew, so you did a really good job there. How are you feeling?
Not too bad.
You're okay? So because you need 200 micrograms of your medication, we're going to do 2 puffs of your inhaler a day. So I'll give you a little chance to rest in between, okay?
Okay.
Before we do the second puff, again, we need to shake the inhaler. 1, 2, 3, 4, 5. Insert it back into the spacer. Are you ready for the second one?
Yes.
Yep. So sit in that upright position again. Exhale fully. Tip your head back slightly, make a seal and inhale. 1, 2, 3. And hold your breath. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And exhale pursed lips. Okay, so that's your salbutamol inhaler administered there. How are you feeling?
I feel better.
You okay? And do those instructions make sense?
Mm-hmm.
Do you think you'd be able to do that with some help from your mum?
I think so.
Okay, no problem. So like I said before, I'll be here for the next 30 to 60 minutes. If you have any side effects, just give me a shout, and I'm just going to dispose of this tray, store your inhaler somewhere safe, and we'll clean the spacer with soap and water. It can be kept for 12 months and then you can get a new one from the GP, okay?
Okay.
So I'm just going to go and do the documentation and I'll get rid of my PPE, but just give me a shout if you need anything. Okay, thank you. Dispose of my PPE and do my hand hygiene. Let that dry and I'll do my documentation. Okay, so assuming that my 30 minutes have passed, I'll go back to my patient, so I'll do hand hygiene. Okay, so hi Matthew, how are you feeling now that little bit of time's passed after your inhaler?
I feel good.
You okay? And you haven't had any of those side effects that we discussed?
I don't think so.
No? Okay, so what I forgot to say before was that sometimes having the inhaler can leave a coating in your mouth. If that happens, just have some sips of water to get rid of it, okay?
Okay.
So now that I've shown you how to give your inhaler. I'll leave you with my number for the asthma clinic, your GP's number, and then if you have any further questions or need shown again, you can just let us know, okay? And if you do have any side effects, please also let us know, and if there's any medical emergencies, just contact 999, okay?
All right.
Do you have any other questions before I go?
Not really.
No? Okay. Well, it's lovely to meet you both, and I'll leave now, so I'll end my station with hand hygiene.